how to enter an initial plan of care in CareManager. So this will be your first plan of care for any of your new members. I'm going to get to my members page here. I'm here in our training environment in the UAT. And the first thing I'm going to do is go down to the CareManager Plan tab, which is where I will be entering the plan of care. Much like everything else, I'm going to click the plus new plan, and I'm going to have some options here. At this point, this is my initial plan of care, and the system knows that. So the only option is for me to select that this is my initial plan of care. There are two other options here, amendment and annual. I'll quickly go over the difference between the two of them. The annual are the annual plans that we are required to update every 12 months per New York State Department of Health. This is the one that will be updated shortly after you do your comp assessment and your SDOH screening that are also done annually, and you'll be using that information to kind of build that annual plan and make any updates needed. When you do your annual plans, don't forget the member signs that member acknowledgement form to indicate that they've participated in the development of the plan and are in agreement with the plan itself. Now, outside of that 12-month window, if you need to add something to the plan, that's when you would use the amendment. Those are the quick kind of one-off. I don't want to disrupt my 12-month cadence of when my next plan is due, but I also have a new need that needs to get on the plan of care because it warrants its own objective on the plan. So the annuals are done every 12 months. They're more of a formal review. The amendments can be done, they can be done telephonically. You don't have to have the member sign off on them. And it's just because we have a new need and we need to get it on the plan, but our plan's not due for an update for a while. So I'm going to open up my initial plan. Your plan start date is going to be the date that you created the plan with the member. When you're ready to finalize your plan, you just click the Plan Finalized button. You don't have to put in an end date. I recommend that you not, just leave it blank. The first three questions you're going to be asked to answer are to put in the client goal statement, the client strengths, and the client barriers. And this is your first opportunity to really start that golden thread. Again, the golden thread being the concept that there are common themes that are woven throughout a member's chart, taking that information that we've gleaned through the assessment, through the screening tool process, and using that to build and inform our plan of care. So if you think back to the comprehensive assessment, the last three questions on that assessment ask, what are your strengths? What are your weaknesses? And of all the things we spoke about today, what's most important to you? So those three questions really translate nicely into these three boxes we have to fill in. The client goal statement is what's most important to you, strengths are strengths, and the weaknesses are the barriers. Now, we always recommend quotes for these, so I can put in whatever the member said here. It can be very high level, something like that. We have folks who, I want to get my children back. I want to move out of my mother's house. I want to get off of AOT. Whatever it is the member says, we can then just put there. Again, we love quotes. You can always elaborate on things in your own words if you want to. That's totally up to you. I'm going to do the same thing with the strengths and barriers here. So again, whatever the member has identified, I can also then elaborate on it as well. So again, I'm taking these ideally from my comp assessment and just sort of plugging them in here into this little template. Now we get to the second half here of the plan, which is where you're really going to put in all of your information. There are 5 different categories, if you will, behavioral health and physical health. So per New York State Department of Health, our plans of care have to have at least one behavioral or physical health goal on here. So you're going to want to make sure you get something under one of these 2 categories, again, with the idea that we are addressing the chronic conditions that made the member eligible for the program and are possibly resulting in them overutilizing inpatient care, or they are not well connected to providers to manage in the community. So we definitely want to get something in one of these 2. Social health is going to be for any of your social determinant of health needs. That can be things like transportation, navigating and managing benefits, utility assistance, food insecurities, and whatever it is the member may identify that they need help with in terms of social determinants. I get a lot of questions about what to put in adherence, and frankly, the answer is you don't even have to use this category. I think people get confused what goes under adherence versus behavioral health or physical health. And if it's too confusing, just ignore it, pretend it doesn't exist. Again, as long as you have something under one of these 2, you're good to go. The care coordination activities I will circle back to in a little bit, but first I want to go through the process of actually getting in an objective and intervention here on the plan and start building it out. So I'm going to start with behavioral health because I know that depression is an issue for my member. Just going to click the plus objectives and interventions. and a new box is going to pop up, and I'm just going to start putting in my objectives and interventions. The objectives are kind of the higher level sort of goal, the intervention being the steps that we are going to take to achieve that sort of overall objective. So in this case, he wants to get connected to mental health services in the next few months. And these are some of the things we're going to do to try and get him connected to those services within that time frame. If I wanted to add more interventions, I can just click the plus add button here and I'll have another row. Similarly, if I have another behavioral health objective, I can keep going and keep entering them in here. The other thing I need to do is select a category. Even though I went into this through the behavioral health section, it still requires you to add one. So I'll select behavioral health. And then last but not least is to tie it to some associated problems. This is the only behavioral health problem that I entered into CareManager. If I had entered more, they would all show up here. You can pick all of them. You can pick one of them. It doesn't matter too much which one you pick. You just need to tether this objective to a problem that's been entered into CareManager. Once I have everything I want here, I just click save, and then I'll be back to my regular plan template here. I can see I've got my first objective and intervention. They all default to new, which is appropriate. And the only other thing I have to do is put in some target dates. So target dates really should be staggered and they should be realistic and appropriate, right? So if the first step here is to research providers that provide telehealth or are local for Joel to get to here, I mean, how long is that going to take us? I'm not going to push that out a year. I know that getting into services is important for him. It's going to be something he wants to prioritize. So I'm going to go ahead and say that maybe by even next month, we can probably get this done, right? Same thing with calling for an intake. Maybe by the end of next month, we're going to try and get that done by the end of August. Scheduling transportation and then his ongoing engagement. These are what we kind of refer to as maintenance objectives or interventions. These are things that might have a longer out target date because we're going to monitor them over time and as needed. You know, for as long as he needs help with transportation until I'm able to get him set up and learning how to do it himself. So maybe that's going to be a few months, maybe by the end of the year, we'll try and get that set up. But in terms of his ongoing engagement, maybe I'm going to put this one out an entire year to my next plan update, just to make sure, see what happens and make sure he engages with it. So that's it for entering the objectives and interventions here. I would continue to do this for anything else. So you will probably have more than one on your plan of care. I'm not going to go through the process multiple times, but I would keep doing the same process for any other physical health, social health, or behavioral health objectives that we want to get on the plan of care at this point. Now, I told you I'd circle back to these care coordination activities here. This is what we recommend to put in some what we call catch-all interventions and objectives. So as you know, or maybe you know, hopefully you know, that once you get your plan of care, once you start writing billable notes, you're going to have to write them against your plan of care. So everything you do is going to have to kind of fall under an intervention or objective on your plan. There will always be one-off things, though, that come up that are not on your plan of care. And folks often wonder, well, where am I supposed to document this thing? Maybe you provide a care transition when the member comes out of the hospital. Maybe they needed help with a utility bill, and it was a one-time thing that we're not going to do again. So it doesn't really need to be added to the plan of care, just so we can document against it. So what we recommend is adding in this care coordination activities section some kind of, again, catch-all objective and interventions that can be used for really a variety of needs, anything that comes up that you might provide support to for your member or your member and their family as well. So I'm dropping in here an example. Hopefully you will get to read them and you can see that they kind of mirror in a way the core services, the 5 different core services. So we're trying to basically, and here I'm going to pick any problems. It doesn't matter. I'll do all 3. Just want to save this so you can see them. But really, these kind of mirror the core services. So again, providing, collaborating with the care team, providing care transitions, providing education and support to the member or his family, and then linking to resources and referrals and things like that. So these I'm going to put on here as my catch-all. I'm going to put these a year out because they're going to stay on my plan really probably forever. I'm not really going to ever take them off. These are okay to always live on your plan of care. So you always have that space to document against. I'm going to put all the target dates out for a year then. And that's it. And now I have this kind of catch-all place where I can document one-off things that come up that are not on the plan of care. So again, your plan will probably have more than just one specific objective and then your care coordination activities. But once you get everything on here, just save and close, and you will have your first plan of care saved in CareManager. I can now see too, if I go to my new plan, I'll now have the option to just do my annual update or an amendment if I need to get something on the plan before next July. I will show you quickly on our website under the member forms and assessments, we have this sample care coordination activities document. When you open that up, you'll get just some samples of the catch-all interventions that I had entered just a moment ago under that care coordination activities section. You are welcome to select one of these to use when you're writing those goals and objectives. You're welcome to come up with your own. You can take a combination of these. There are 3 examples here. You only need to add 1 to your plan of care. But again, we do recommend it just so you have that spot to capture documentation for those one-off things. And that's it for your very first plan of care.